Do you have a family plan through your employer where they pay for your premiums, but you have to pay for your children's premiums in full? If so, then stay tuned to this video because I may have a possible solution that could work for your situation. Okay. And if you know somebody who is in this situation, then, you know, please share this out so that they get access to this information. Okay. And so if you are new to me, to my channel, to any of my content in social media land, my name is Katrice Daniels. I am a licensed health and life insurance broker and the principal agent of the K Daniels Insurance Agency, where at this agency we help African Americans to navigate their insurance options and to enroll into affordable comprehensive coverage. I am also the founder of Insure Black America, where the mission is to close the coverage gap in healthcare health insurance for health insurance for African Americans. Okay. All right, so let's get into this. So you have a family plan, and your employer pays for your premium, but does not pay for your children's premium. So you have to pay that in full. Okay, and so you may be wondering, can I just buy individual policies for my children instead? Okay, now, prior to 2023, the answer would have been no, because your children would not have been eligible for subsidies in the health insurance marketplace. Okay. But the rules have since changed. And so now they may be eligible for subsidies. Okay. They could also be eligible for Medicaid and CHIP depending on your household income and also depending on what state you live in. Okay. So you would have to check that out with your state. Okay. As far as the income limits. Okay. Now the ACA's employer mandate requires that businesses with 50 or more full-time equivalent employees to offer health insurance to their full-time employees and those employees' children. Okay. Now the coverage must be considered affordable for the employees. There is no requirement that it has to be affordable for the children. Okay. For any or any dependents. Okay. Um, so and like even when you look at the 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 insurance plans, when they're employer sponsored, the employer is paying a large portion for the dependents. However, the portion that you have to pay after the employer pays what they're going to pay doesn't have to be affordable for you. It only has to be affordable for you for yourself. Okay. If it's when it's the employee's premium. Okay. Not the dependent's premium. Okay. Um, and so, and if you think back historically, um, family plans have always, been, in my opinion, a little outrageous, based on, the ones that I've had. They've always been a little outrageous. There was only one employer that I actually worked with that the family plan was not only good, but it was actually affordable. Um, okay, but moving right along. Okay, but in order to be in compliance with the employer mandate, okay, the coverage that employers offer to their full-time employees for employee-only coverage can't cost more than 9.12%. Okay. All right. So prior to 2023, um, if the families, if the employer's coverage was affordable, as long as the employees' um, coverage was affordable, then family members, nobody in the family was eligible for subsidies. Okay. Um, And so you may have heard of this. It's called the family glitch. Okay. And so that's what the family glitch is. Well, was, okay, was that, um, if long as the employee's plan was affordable, then you couldn't get subsidies for anybody else. Okay. But now under new rules, okay, as long as if the okay under the new rules, if the cost to cover the family under the employer's lowest cost plan, okay, but that plan still must provide minimum value, okay, it's more than 9.12% of the family's household income, okay, the family members are potentially eligible for subsidies in the exchange, okay. The employee would not be subsidy eligible because they have insurance, okay? But it's for the family members, okay? Now, whether you depend on whether you are eligible for subsidies or not depends on age, location, and total household income, okay? Now, even if the children aren't eligible for subsidies, you still do have the option to buy coverage for them in the individual market, okay, through the exchange or off exchange and pay full price, okay. Now, I know you're probably saying, "Hell, I can't afford my employer sponsored coverage. I definitely can't afford full price," and yeah, I get that. However, I just have to let you know that that too is an option. Okay. Um, if you're not going to get the subsidies, then there would be no point for going through the exchange. You could just get the same plan off exchange. Okay. Um, and pay full price for it. That also is an option too. And I don't think a lot of people understand that is that you do not have to have the use the tax credit in order to purchase insurance through the marketplace. Okay, you can go off exchange, which has the same pretty much, yeah, it has the same plans, but you're just going to pay for a price for the plans. Okay, versus when you're on exchange, it goes by the subsidy. Okay, the subsidy is helping to with the cost. Okay. Um, Now, if you live in a state where Medicaid has been expanded, then more than likely your children would be eligible for Medicaid or CHIP, which is the Children's Health Insurance Program. And it's where you might pay, depending on your income, the lowest I've seen um, for in Florida when doing Florida Kid Care. When I got Florida Kid Care for my kids, I think the lowest I paid was like $15 a month. But it does go off of your income. Um, but that's something that you want to also check into. Okay. If you apply for Medicaid in your state and you get denied, okay, based on your household income, then you would be eligible to shop the marketplace and purchase insurance for your children through the marketplace. Okay, that would give you a special election period, and then it would also give you you would be eligible for the tax credit. Okay, well, you may be eligible. Like I said, it depends on household size and income, but more than likely, if they deny you for income with Medicaid or CHIP, then you will be eligible for subsidies in the marketplace. Okay. All right, so those are some options, okay, that you can definitely check into. Now, if you have never purchased insurance before, outside of your job, and now this is your first time and you're having to purchase insurance, I want you to go get my free gift to you. It's a checklist, okay? It's the before you buy health insurance checklist, okay? And on that checklist, it has the major things that you need to really focus on and have some type of information about, some understanding about, before you go and purchase health insurance. Okay. um, because you want to understand exactly what it is that you are investing your money into, and exactly how it works, because that is one of the things that I have noticed um, in working with African Americans, is that we tend to not purchase or make any moves towards something we don't understand. Like, we're not gonna buy it and be like, "Oh, I'll learn it later." Especially something like insurance, something that we kind of look at as a scam in somewhat ways. You know and so you want to educate yourself exactly on what it is that you are investing into, so that you understand. Okay, yes, it's health insurance, yes, it's important, but if you don't understand how it works, then you're not going to take full advantage of your investment. Okay, and so you want to go get that. It's absolutely free. You can go to my link tree to get that. The link is in the description of this live. Okay, now if you have any questions, okay, or you would like to schedule an appointment, an insurance consultation, you can go to my link tree and book an appointment. Slots are filling up. Okay, so you definitely want to go and get you a slot. Okay. At this time, I am not seeing taking any clients on Mondays or Saturdays, so it would be Tuesday through Friday. Okay, that you would have to get your appointment in. Okay. All right. And so I hope this was helpful. If it was, or informational, if it was, please do share this live out with others, so that they can grab hold of this information as well. All right. You have a great rest of your day. Also, thank you for all the love that you've been showing to the K Daniels Insurance Agency YouTube page. We just hit 4,000 views on yesterday for the channel. And so that's super excited. I just started it back up like a month ago. And so we've already hit 4,000 views. So that's really, really great. Thank you so much. Thank you for all your continued support. I look forward to working with you, all of you, whoever's watching. I look forward to working with you, to helping you to come to get what you need as far as your insurance needs, your health needs met, and also looking into life insurance as well. Okay, so have a great one. I will see you on the next video, and remember that together we can close the coverage gap, the insurance coverage gap for African Americans. Have a good one.